So at our session today, we were talking about health and housing. So in the context of a working system that makes sure that health colleagues and housing colleagues are working together to find that shared vision. We often have exactly the same customers with exactly the same needs, but we often come at it from completely different angles, often finding different language and often disagreeing. So it's a partnership that we've formed in Milton Keynes between ourselves, Public Health and Peabody Housing Association to really do some community-based work to tackle health and housing as a single system. So some of the benefits that we're seeing for our residents is that actually often they're really connected benefits. So healthy lives means that they can live better lives. And what we all want in housing is for people to have better lives. And we also know that housing is a central pillar of that, not just as a human right, but as a springboard for people's future aspirations. So what we've seen some of our customers benefit from is our community hubs, both for us and Peabody, where they've been able to get really great access to health services such as weight loss management, smoking cessation, mental health services, pathways into drug and alcohol, and the benefits for them has been life-changing. So the next priorities for us as a project is to do two things. So expand our hubs and build on the learning that we've had from our existing hubs and think about how do we develop healthy neighbourhood strategy, use better data and insight both from a health and housing perspective to identify, target those neighbourhoods where we can go in and do some interventions. But then secondly, about how do we build health and housing into our core strategies. So how do we look at damp and mould, not just from a housing property perspective, but think about the health implications of living in a poor house and pathway people into those services as well. So how we got involved in the first instance was off the back of a really complicated neighbourhood that was suffering with crime, antisocial behaviour, high level of arrears. And we're targeting it from a safety perspective, so doing all the traditional things that we do as a housing association. But discovering underlying issues there around health inequalities. So how we then worked with our health partners to create that community hub and start to work from both ends of the same spectrum with a shared vision. So, understanding that actually part of the financial inclusion work that we were doing was around helping people to stop smoking that costs people £3,500 a year. So if we tell people to stop smoking, they know it impacts on their health, but actually if we tell them it's impacting on £3,500 a year, suddenly there's a motivation for people to stop. So it was a real driver for us to look at it from the housing perspective, but really understand that good quality housing helps people live better, healthier lives as well. So if people are really interested in doing this piece of work, I think there's three tips for me. One is look at your housing strategy and your local authority's housing strategy, and then look at your health and wellbeing strategy, because I tell you, the two will be massively, massively aligned. So really great opportunity to bring those two together and find that shared language. Shared language is really, really important. So finding somebody in health that you can talk to, that enables you to be able to find that shared language and talk about that is tip number one. I think tip number two for me would be around starting small. Do something that works and then make that the story. So make that, whether it's a community, whether it's a great story about people, that enables you to keep talking about that. And I think the third tip for me is make sure that it's strategically aligned to your organisation. So it's not bolted on as a project, but something that people recognise as that's what we do because that's who we are. And I think if you can do that within the organisation, you've got a great chance of success. So the positive change in our community. So just if you take our Bilberry Road hub, we've had 20 public health services supporting at that service, and that service is from smoking cessation to weight loss management, drug and alcohol, mental health services. 600 people through the doors there that has enabled people to really change their lives, whether it's to stop smoking, whether it's to live healthier lives, whether it's to just get that companionship and that ability to be able to talk about how they're feeling and what next. So what we've seen is some really brilliant stories, and if people want to read more about some of the case studies, CIH have done a brilliant publication that we've contributed to that tells some of those stories in there.